pleased to be able to introduce you to Tracy Russell, who is the Executive Director of Nurture Kansas City, and Dr. Sharla Smith, who is Associate Professor for Preventative Medicine and Public Health at the University of Kansas School of Medicine. So without further ado, I'm going to ask for each of you, please, to make sure you have your cameras turned on. And we are going to get started. So why don't we just kick it off? Tracy, if you don't mind, we'll just begin with you. If you don't mind introducing yourself, tell us a little bit about your background and the background of your organization. And then Dr. Smith will have you to do the same.
Great, thank you so much, Fran. And it's really an honor to be here with the Match Coalition. I'm so excited that you're putting a spotlight on maternal health. It's very important to my organization. And so at Nurture KC, we are a Healthy Start grantee, and Healthy Start is a federal program serving pregnant women and their families. We serve babies up to 18 months old. And this is a program that's been around for 30 years. There are 100 Healthy Start grantees across the country. And the other site in Kansas is in Wichita. So it's serving our urban centers of the state. My site serves Wyandotte County, which is Kansas City, Kansas. And Healthy Start serves families from the zip codes of the city with the highest rates of infant mortality. So for us in Kansas City, Kansas, that is 6 zip codes. And we work very hard to reduce those odds and reverse them, as a matter of fact. And each year we serve about 700 program participants, 300 pregnant women, 300 children up to 18 months old. And then as a new part of this grant cycle, we serve 100 fathers as well, which I think is an extremely important component and one that we should be doing. We utilize a community health worker model. So our community health workers have that one-on-one relationship with the families. And we feel like that's really the key to our success, is these moms trust the community health workers. They're there to help them with a number of issues, not just getting them access to health care, but really helping them with those life issues, whether that's lack of housing, lack of food, mental health concerns. They really are there to support them through that process. And I think the other unique feature of Healthy Start is it is also a data-driven program. We have several benchmark goals that we are tasked with meeting each year. And so because of this data collection, it's very easy for us to determine, okay, where are we successful? What isn't working? How do we improve? So it's not just throwing stuff out there to see what sticks. It's looking at data-driven evidence and working from that and combining it with that human touch that really makes the program successful. I actually come from a political background. I was a lobbyist for about 25 years. So organizationally, we've incorporated that piece in as well. I feel like you can't change the culture and have broad outcomes without that policy piece. So that's been critically important to us organizationally. So it's really a combination of policy and direct service and education at Nurture KC.
I love it. And very valuable, and certainly evidence-based is the way to go, right? I mean, there are certain areas we want to make sure that where we build that confidence and create for opportunities for scale. And it certainly comes out of taking those types of rigorous approaches to what is adopted. So thank you for that. And now it's my pleasure to introduce Dr. Sharla Smith. Dr. Smith.
Greetings, everyone. It is a great pleasure to be here and to be on this platform. Again, I am a professor at the University of Kansas Medical Center and the Director of Birth Equity Programs for the Department of Obstetrics and Gynecology. And in my role, which really includes a lot of community engagement and clinical research, I have worked to found and direct the first Kansas Birth Equity Network in the state of Kansas. And our mission is really to use a community-centered approach to create solutions that improve Black maternal, paternal, and infant health in Kansas through training, research, healthcare, and advocacy. As a part of this work, I created a birth equity training program, which is really focused on anti-bias, anti-racism, and elevating the voices of Black moms and dads and caregivers. And so it's really focused on creating and being intentional about providing care. And so in our network, we have 44 diverse stakeholders across the state of Kansas, including parents, caregivers, faith-based leaders, physicians, and organization directors are their designees. And we come together each month to create a 5-year research agenda to really focus on research, healthcare, and advocacy, and to really develop a plan that we can collaboratively move forward in the next 5 years to really create solutions and improve maternal, paternal, and infant health. And this work was birthed out of a community initiative that I started in Wichita, Kansas, called the Kansas Sisters and Brothers for Healthy Infants, which brought together Black fraternity and sororities to create awareness around maternal and infant mortality and disparities, and to elevate the voices of Black moms and dads. And so through that work, we developed an event each year called Celebrate Day 366, which is an opportunity for us to change the conversation from death to celebration. So the idea behind Celebrate Day 366 is that we would educate the community on what we meant by infant mortality and maternal mortality, and then we would educate them on co-parenting and the importance of fatherhood. And then we would celebrate more and more Black babies living past the 365-day mark, hence Celebrate Day 366. So we use this opportunity in a virtual format to really elevate the voices of Black moms and dads and Black caregivers. So whether those are physicians, doulas, midwives, or others. And so this work has really been driven to be an engagement component of the community and to hopefully create a resource hub for every Black family in Kansas.
How exciting. And I love that emphasis on, really acknowledging our successes in ways that matter in communities, right? So we spend a lot of emphasis on, especially, a public health and epidemiological perspective, talking about the numbers are not desirable, but to take a moment to appreciate where we have made so much progress and directly how that is, translated or shows up in communities in terms of the healthiness of families and babies is phenomenal. So we applaud you for that work. Why don't we, I'd love to open this question up to both of you, Tracy and Dr. Smith. Talk to us a little bit about some of the challenges. I mean, both of you have mentioned really phenomenal programs that you're doing locally, but I presume that has not been without some challenge. Can you talk to us a little bit about some of the challenges that you have been facing and sort of what the outlook is today in terms of gaining cooperations amongst those who are instrumental in the programs that you're developing?
Sure, I can start us off, and Charla, please jump in. And Charla and I know each other, and I so respect the work that she's doing in Wichita. I think one of the biggest challenges from a state perspective is the lack of Medicaid expansion in Kansas. I feel like that is fundamental to much of what we talk about when it comes to maternal health. Kansas remains one of 12 states in the country that hasn't expanded Medicaid. And so it's basically Kansas and the southern United States, and then Wyoming and Wisconsin, I believe. And we know, because we have the benefit of the other 38 states that have gone before us, that maternal and infant health outcomes improve dramatically in states that have expanded Medicaid. And as a matter of fact, if you are uninsured, you are 3 to 4 times more likely to die from pregnancy complications. Seems like a pretty fundamental fix that we should be looking at. I am very excited to see, within the Build Back Better bill, that extended postpartum coverage to 1 year. We are very supportive of that, and it has been a priority at the state level for quite some time. And, not only from that very impactful health result that would come from it, but I think also as a means of kind of changing how we view women and their health, not just looking at them while they are pregnant. And, I often say we shouldn't just care about women as incubators, that we need to look at what happens after the fact. We see a lot of morbidity and mortality occurring after that 60-day threshold where they end up dropping off coverage and cycling in and out of the healthcare system. So I think that's a very key area. I think another focus that we have been looking at internally is around mental health issues. There has not been much attention to that until recently. And you have to look at that internally. We actually have counseling for our postpartum moms who are dealing with mental health issues. So I think that's another key that we need to look at. And I think particularly when we're talking about the urban centers, there's almost this feeling of otherness that happens in a rural state like Kansas, and that perhaps we don't prioritize and value the birth experience for those families, and that we need to turn some attention to that. And then one other local issue that I would mention is we've had several families struggle with housing. Clearly the pandemic spurred that, but it's a continuing barrier that our families are struggling with. And as a matter of fact, just recently we've had 5 families who found themselves homeless, either during pregnancy or postpartum. I mean, can you imagine facing that in addition to dealing with a new infant? And so we will continue to work on those issues and other social determinants of health.
Yeah, so I'd like to agree with Tracy and say that I do think one of the barriers is an expansion of Medicaid. But I also want to challenge the group to think about the fact that often when we talk about maternal health, we start with the conversation of social determinants of health. And if that is truly our focus, we know that about 80% of our health outcomes are on our physical environment, social determinants, and behavior factors. And a lot of these are driven by our income. However, in our country, no progress has been made to reduce the income and wealth inequalities between Blacks and white households for over the past 70 years. So we can't really talk about the social determinants of health when we aren't moving forward to reduce some of these factors. The other thing that we see when it comes to Black maternal health is that Black mothers who are college educated fare worse than women of all other races who've never finished high school. We also see that Black women in the wealthiest neighborhoods do worse than whites, Hispanic, and Asian mothers in the poorest ones. And Black women who initiate prenatal care in the first trimester still have the highest rate of infant mortality than non-Hispanic white women with late to no prenatal care. So I would just challenge the group that this conversation, while social determinants of health are a factor, that really what we see in the root of these issues is racism. And whether or not we expand Medicaid or we address some of these issues, if we don't address racism and we don't improve the quality of care that these mothers receive, we're not going to move forward. And so the reality is that as a system, and as individuals, we have to do a birth equity shift. And that means shifting from blaming women for poor health outcomes to system level accountabilities for programs and policies. But we also have to create these systems that improve health and these systems of trust, because we have mistrust in the Black community. So you see a lot of mistrust, and COVID highlighted that, but that has existed for over several years. And we see when we talk to our parents, we hear the conversations, I don't want to have a child, or I dare not have another child. And that is because their experiences with the medical care that they receive. And so we have to start with increasing the number of African Americans or Blacks that we see in our healthcare system, which means in providing those opportunities for education so that they can get those educations and they can go into those areas and they can provide care, or that other physicians can have an experience with other races, so that when they're providing care, there's a deeper understanding of what the factors that that person is dealing with. So I think that a lot of our challenges is just that it's been an inability from our system level accountability to recognize the strengths of the Black community. We often focus on what is wrong with the Black community rather than what is going well. And then we also don't focus on birth equity because we're focusing on those things that actually blame mothers for their poor outcomes rather than system level accountabilities and policies.
Wow, these are such amazing remarks. I applaud you for being able to call out some of the challenges that in many are sometimes perhaps considered the less tangible things that are impacting communities and experiences. And in fact, this concept around system of trust was one that we most recently heard during the virtual Heal Day, where Representative Davis spoke to challenges in communities of color and inclusive of the Native American indigenous communities as well. I would love if you could perhaps, Dr. Smith, give us an example of a program or an opportunity that you see coming into the new year that really takes this notion of creating systems of trust and having that be translated into the development of programs or perhaps changes in the way that care is being delivered.
One of the programs is the Kansas Birth Equity Network. It is an opportunity for us to bring together these diverse stakeholders, but to also have the mothers and the fathers at the table, so that when we're having these discussions about solutions, that they're also included in those determining factors that would lead to solutions, right? So having their voices at the table. The other program is that here at KU, at the KU Medical Center in Kansas City, we have started to develop a birth equity program. And so that birth equity program is going to look at all aspects of birth and care within KU walls to really determine how do we become an equitable OBGYN department in providing care to our population. And so a part of that is working with labor and delivery, is bringing in doulas to provide support to moms, that outside support that is really needed, and some follow-up care. We are also working on creating group prenatal care as well as virtual group postpartum care. So to really address those issues within that postpartum period that happened before the mom comes back for the visit, and to address these access issues, time issues, right, and healthcare issues and concerns, because when we know that when parents are in a group, they also learn from their peers. And so I think this program, as well as our opportunity to collect better data, to really look at what are the disparities that are happening, not only in prenatal care, but in labor and delivery. And so we're really working hard to create a birth equity program at the University of Kansas to improve the outcomes for moms, and as well as being inclusive of the father's involvement.
That's fantastic, and I love that point on fathers, because that's so key, and they're often very much forgotten, and yet so vital in terms of being able to support, having partners to be able to know where to go and resources to have access to. Tracy, when I think about Nurture KC and some of the work that you all have done, I've noticed that you have expanded your programs over time. Has some of this picked up on elements that Dr. Smith has also referred to? Can you share with us a little bit about some of those initiatives?
Absolutely. Internally, we wanted to find what our families needed and looking at the whole health of the person rather than just during pregnancy. And so to that end, we have a relationship with one of the local hospitals to have a nurse who exclusively sees our high-risk Healthy Start moms. That was one issue that we expanded on. We provided prenatal yoga on our site. We have healthy cooking videos from local chefs that we are putting out there. We are actually just launching a financial literacy class for our participants this week. And so we will continue to respond to what our families say they need and do everything that we can to fulfill that. I think, it can often be the trap of a nonprofit where we'll think organizationally and not put the emphasis on mission. And we try very hard to to focus on mission. And just going back to one thing that Dr. Smith said, you know, at a state level, I would say Kansas has been a bit of a mixed bag when it comes to addressing the equity issues. Of course, we do have a maternal mortality review board. Dr. Smith is on that, as well as one of my staff is on that as well. But as an example, we had legislation introduced during the last legislative session that would have looked at maternal deaths and applied a lens of race to that, and instructed the Department of Health and Environment to collect that data, determine if racism was involved in the death and other factors that we don't normally consider as a point of course. It also would have established an outside stakeholder review board or community group that would also get to look at that and make their own recommendations. I will tell you that bill did not move. And until we start putting everything through that lens and considering all the factors that we all know are affecting our birth outcomes. I mean, you can't look at the data and not see that it's a different story for white women versus Black women. And so I would like to see us as a state move in that direction. And, you know, we will keep doing what we need to do at the local level, and we're serving 700 a year, but that's not enough to affect change across the state.
So is there an intent to reintroduce, to attempt this one more time? What do you think is going to take place?
I am really hopeful that it will be reintroduced. It, you know, often, and Kansas is no exception to this, you know, most of us in the political world know that it takes years to make headway on many issues. This was the first time that I had seen that legislation introduced. And, you know, it's a slow process, but I think with all the attention we're seeing at a federal level on maternal health, I think it's helpful. It feels like we're at more of a tipping point than we have been previously. You know, and if you'll recall, until, I don't know, probably 5 years ago, you didn't even hear much about maternal health until people started looking at what the US outcomes were compared to the rest of the world. And it's almost like we treated pregnancy as just this natural occurrence and not acknowledging the risk and the trauma that goes along with that.
Very valid points. Please, Dr. Smith, jump right in on this one. Any thoughts?
Yeah, so I was one of the 3 community members that worked on revising that bill for Maternal Mortality Review Committee. And I think that what Tracy mentioned is absolutely true. We have to start to really look at what's happening in the disparities and focus on having an outside community group that would review those. So strengthening our data, focusing on having an outside group. But I think KDHE, that bill, while supported by a House senator and a representative, was not supported because they felt it was implementation and not policy. But I would challenge them that if it's policy, then it doesn't change. If they implement the few changes at the state level, then if leadership changes, those changes are not, you know, they don't have to keep those in place. And so the reality is to create a policy that is more focused on the disparities. And that would actually mean that we would continue as a state to focus on those disparities. And I would say with the Maternal Mortality Review Committee, that we also lack representation at the table. I think I am the only person of color that serves on that committee. And so as a state, we'd have to see more representation at every table in order to truly address the disparities. You're on
Fran,
mute,
you're muted.
Fran.
Oh, thank you. There have been a lot of articles that have been written on subjects of other inequalities that just begin with the access to care and for women in general, right, across the board. So for example, access to leave, paid maternity leave, or even still the challenges that exist in terms of equal pay between genders. is a challenge. And certainly that just gets perpetuated as you go down and identify other areas of diversification. We're about to jump into the Q&A time where the other participants of today's program have an opportunity to ask questions of you. Before we jump into that one, I have one final question. Of course, the MATCH Coalition, which is an acronym for the Maternal Applications of Technology in Community Health, is really focused on the value that digital technologies can bring to improving these issues that we see in maternal health. I would love for each of you to share an example of how you are either today utilizing technology or you're anticipating in the near future to employ digital tech as a way of sort of counterbalancing some of these problems that you're in the process of addressing. Tracy, you want to start? Mm-hmm.
Sure. So, you know, I feel like the pandemic exacerbated our use of technology for sure. We stopped having in-office and home visits during that time. And what we found is our community health workers maintained that relationship through apps and WhatsApp in particular to make that connection with their participants. I would anticipate going forward that we will have some reliance on that. And we have several participants who do not have access to transportation. And so I think from their perspective, that was very helpful. You know, we hear a lot about this investment in high-speed internet and, you know, at a federal level. And we see that as much in the city as a lacking resource as, you know, I know that the focus tends to be on the rural areas around high-speed internet. And I think what we do a poor job of doing is kind of selling what the benefit of that is. We talk a lot about we need high-speed internet. Well, why? Well, one of the reasons is it could definitely improve maternal health outcomes. I know that in a state like Kansas, where we've had, you know, hospitals close and fewer women's health providers, that anything we can do to provide those virtual visits and recognizing that they are a complementary component and definitely don't replace the in-person touch, but you need both tools. And I know that, for instance, in Missouri, in the Boot Heel, they actually have a relationship between kind of urban specialists and some of those rural maternity providers so that they can speak virtually and serve those constituencies. And I think we're always going to have to adapt and evolve in terms of how we provide care. And as just one more example, I know that our nurse, when she couldn't see participants in person, was having video conversations with them and checking on them. And I just see us expanding that role and really making use of that as we should, and recognizing that it's going to be a very important part of care going forward, and general health, preventive health as well.
Excellent points. Dr. Smith?
Yeah, so similar to what Tracy mentioned, COVID definitely made it so that we had to take on a more virtual approach. And so our KBIN meetings are in a virtual setting on Zoom. We also have parent meetings with just the parents in those in the KBIN network, and to just strengthen their voices. So we have those mentor meetings outside, which really ends up them mentoring us. But those are virtual meetings. And then we also have our birth equity training, which is also online, and online training that can be taken by the network members. One of the things that we're working on is we're really working to redesign prenatal care and to create a hybrid model. And so that would be group prenatal care that would be done virtually for some appointments, but in person for others. And that would include Bluetooth scales and Bluetooth blood pressure cuffs. And so I'm currently writing a proposal, but we're seeking funding to do that and pilot that at KU, which would eliminate those access issues, as well as create some consensus around care and support for the mom social support systems. And our Celebrate Day 366 annual event is also a virtual event that is done on Zoom. We have a Black Baby photo contest, but we also have that Sunday, which is called a Birth Equity Walk, and it's virtual as well. You can do that wherever you are. The goal is that at some point we will have those opportunities on an app that we can really, the moms can monitor their blood pressure. They can have support groups to talk about the things that the challenges that they're facing, or how to breastfeed, or what are some of the tools. We know that mothers support each other on Facebook, but to have that app at their hand that really what to expect, when you're expecting, and what to expect after delivery. So really to put some of those resources on an app at some point to really distribute amongst our moms and our dads as well.
These are such beautiful examples from both of you. Thank you so much. I know that we've covered a lot of ground and that undoubtedly some of our attendees have questions. So without further ado, this is the time when we like to have to ask everyone to come on to video. And certainly if you have a question that you'd like to ask of our distinguished panel, please do so. There might be several questions, so perhaps if you want to raise your digital hand, that might help a little bit. I think Elizabeth, you may have had a question, you popped in earlier. So why don't we begin with you, and then we'll allow for others to take the stage as well. Elizabeth?
Sure, thanks, Fran. And what your organizations are doing is really, really impressive. So congratulations on all the good work that you're doing. Obviously, there is a long way to go. And Tracy, I'm interested in the advocacy piece of the work that you're doing, because I am helping assist the Match Coalition with Allie Foley, my colleague, on the advocacy work that we're doing. And you mentioned the legislation in Kansas that didn't move. And I'm just curious whether you've talked to your senators or your federal senators or members of your representatives in the House from Kansas about a similar initiative federally.
We have a very strong relationship with Representative David's office. They have been just a fantastic partner, and she happens to be my representative, as a matter of fact. And so, yes, we definitely speak to them about these issues. And I think, even at a state level, when you look at the Medicaid expansion issue, where I feel we have value is we can explain how it affects our moms and our babies, which is different from the population at large. So for us, when we engage, I always want to make sure that I tie it back to specifically why we're interested organizationally and kind of connect those dots for people. We also get involved in several immunization issues as well. When you look at the COVID impacts for pregnant women, it's very disparate and severe. And so we tie it back to that and really show a very unique perspective. In Kansas, we cannot have a referendum to enact Medicaid expansion. It has to happen through the legislative body. So it's a little bit different. But yes, I would say we continue to weigh in more and more on those federal issues. And it's just so great to see them finally getting the attention that they deserve, because that's been a long time coming.
Well, you've obviously done a fantastic job with Representative David. So,
well, thank you.
Look forward to working with you in the future.
Absolutely.
Thank you, Elizabeth. Dave, you had your camera on. You would like to ask a question? You're on mute, Dave. Dave Bond, we can't hear you.
Yeah, sorry about that. No, it was interesting, the comment, I think it came from Charlotte, in regards to proactive monitoring and using Bluetooth and proactive measures to get ahead of the issue with high-risk pregnancies. How far along are you, Charlotte, in that process of developing a strategy around proactive monitoring at home?
Great, thank you for the question. So I think I'm currently writing a proposal to seek funding to implement it, but I will say that we're pretty far along except as in a way of gaining support. So our OBGYN chair and the physicians that are providing care to moms, to birthing persons, want this program, and they have desired it for a number of years. We've also been talking with other agencies that are doing this work as well. And so this program would be innovative in that we would add the blood pressure cuffs and the Bluetooth scales for continuous monitoring, and it would be a hybrid model. But as far as gaining support, we do have the system level support to implement the program. We do not have the funding to do so yet.
And what, just a follow-up question, where are you seeking funding for this?
Currently, I'm seeking funding from the NIH to implement the program so that it will be continuous funding for 5 years so that we can basically perfect it and continue it. I don't think we need funding to actually implement the program, but to make sure that it's sustained over time and to study the outcomes and to recruit participants, randomize them to individual or group care. We would need funding for that, and to have the monitoring of the blood pressure and of course, we don't have the blood pressure cuffs and the Bluetooth scales either.
Yeah.
All right, well, those are really all very good questions. And I think that taking, the example that Tracy gave of how neighbor states are utilizing digital technology is a great way to begin to learn. Do you both find yourselves doing that, in fact, sort of looking to your neighbors in terms of some of the ways that they have implemented, or some perhaps similar organizations and the work that they're doing? Are there any followers, any particular organizations that you find yourselves following? And that's a question for either Tracy or Charla.
In my part of the state, we actually straddle the state line here. So we serve both Missouri and Kansas. So yes, I definitely look and see what's going on. And I think the beauty of being one of 100 Healthy Start sites is there's a lot of collaboration. We can look at what others are doing. And it's almost competitive in a way, which I think is great, because I think that kind of spurs everybody on. But for instance, we're going to be rolling out group counseling for some of our Hispanic moms that we serve with a Spanish-speaking counselor, and we've seen this happen elsewhere in the country. So yes, I would say, no one has ownership of an idea. We certainly share, and it's really the best approach. And I know that Charla said at the top of the panel that there is some separateness in how we approach maternal and infant health in the state. And I totally agree. I think the more that we would all work together, the better these outcomes would be.
Mm-hmm. Absolutely. I want to make sure, Dr. Smith, you have a chance to just very briefly, I want to make sure we get time in for one more call, but one more question. But if you could just is there an organization that you find yourself sort of looking to? Is there a peer or sort of a mentoring that with the university, I'm sure there's collaboratives as well that you're involved in. Is there one that you'd like to call out in particular?
Yeah, sure. So I'm currently working with WashU and a group of physicians, Dr. Tracy Johnson and Dr. Devika Malik, and on the Missouri side in Truman, to implement group prenatal care, which is coming in January. And so all the things are in place to do that. It's Elevate, which includes postpartum depression treatment as a part of group care, and perinatal depression treatment as well. And then I'm following a group in New Jersey, which had to implement virtual group prenatal care during the pandemic.
Very good. I love that. When we were first saying we were going to bring in KC, Kansas City, everybody's head went to Missouri. And I was like, no, people, I want to bring in Kansas State. So we brought you all in. So it's good to make that differentiation, and for you to also share that you have such a strong collaboration with your neighbor state of Missouri. So thank you for that. We're going to take one more question from John Sharp. John, please go ahead, ask your question.
Yeah, I was wondering, with the discussion of Medicaid expansion, does anybody know of remote monitoring becoming part of that, part of Medicaid, or is that, again, a state-by-state issue?
I would assume that would be a state by state issue, what they include in their plans and of course, what gets reimbursed, which is one of the important parts of implementation. I know that there has been an emphasis, particularly in the state of Kansas, around telehealth. And I know that, for instance, University of Kansas hospital system is pursuing that as a top priority. To me, that seems like a natural evolution to get into some of these other technology measures. But I will say I'm not as familiar with the specifics of that.
I would say in my research, John, that most of the states that have implemented this continuous monitoring has done it with outside grant funding. And so we are just trying to make sure that that is Bluetooth so that it goes directly to the provider, which is providing care to the patient.
Very, very good call out, and clearly an opportunity for more education amongst CMS at the state level to start to happen between the digital community, digital health community, and state and local administration and governments. And that's why groups like the Match Coalition are here. And so with that, I would just want to thank you both. I actually got a little bit of kind of a goosebumps, to tell you the truth, because the points that you both made are just so relevant, but the way in which you articulated them were very specific and very spot on, and so authentic from the standpoint of what you're sensing, what you're feeling right there in Kansas. So regardless of if you're in San Diego like I am, or you're off in DC like Elizabeth and David, the fact that you were able to bring that to this stage with us and share it in a way that just feels so real, we just really thank you for that. And we look forward to seeing you on future events. Please do continue to join us and to encourage your neighbor states, as we are going to be making phone calls to invite them to come and share about their experience.